What's going on, guys? It's Jimmy here. Welcome to our daily show where we discuss everything you need to know about and what's going on here in our country on a daily basis, including money, investing, the stock market, the fourth stimulus package update, and stimulus check update. If you haven't subscribed to our YouTube channel yet, make sure to click the subscribe button down below. It's completely free to do so. And remember that new videos come out here every day at 10 a.m., 3 p.m., and 8 p.m. Eastern Standard Time. The Democrats and Senator Bernie Sanders are pushing for major changes to Medicare. And I'll let you hear directly from Senator Bernie Sanders, who just had a conference and meeting here. Check this out. We got a lot of different things to talk about here in this video. First, we'll start with Senator Bernie Sanders here on Medicare. Check this out.
And the tens of thousands of doctors, nurses, and other healthcare professionals who support this legislation. Let me thank the 15 Senate co-sponsors that we have on this bill and the 122 members of the House who support very similar legislation. And mostly, let me thank the American people who by the millions understand, as I do, that our current healthcare system is dysfunctional, it is extraordinarily wasteful and expensive, and it is cruel. The American people understand, as I do, that healthcare is a human right and not a privilege, and that we must end the international embarrassment of our great country being the only major nation on earth that does not guarantee health care as a human right to all of its people. It is not acceptable to me, nor to the American people, that over 70 million Americans today are either uninsured or underinsured. As we speak, right now, this moment, there are millions of people in our country who would like to go to a doctor, who have to go to the doctor, but simply cannot afford to do so. This is unacceptable. This is un-American. And this cannot be allowed to happen in the wealthiest country on earth. Bottom line is that your health and your longevity, how long you live, should not be a factor of how much money you have. Healthcare is a human right that all Americans, regardless of income, are entitled to, and all Americans deserve the best healthcare that our country can provide. As chairman of the Budget Committee, it is not acceptable to me that we end up spending over twice as much per capita on healthcare as other major countries around the world. Something we don't see too much on TV, you don't read in the newspapers, you don't hear it discussed here. My friends are concerned about the budget deficit, concerned about how much money we spend. Well, somebody should talk about why it is that we are spending almost twice as much per capita on healthcare as do the people of any other major country on earth, while at the same time, despite all of that expenditure, our life expectancy, how long we live, is less than most other major countries, and our healthcare outcomes in a number of areas lags behind other countries. Unbelievably, and I want the American people to hear this. You know, we talk about budget deficits or anything else here. Unbelievable, according to the Center for Medicare and Medicaid Services, CMS, we are now spending $12,530 per capita on healthcare. You got that? $12,530 for every man, woman, and child in this country. This is an outrageous and unsustainable sum of money. And here is the important point. In comparison, let's take a look at what other countries are spending for healthcare, which is as good or maybe better. United Kingdom spends $5,200. Remember, we spend over $12,000. Canada spends $5,300. France spends $5,500 per person. Germany spends $6,700. All of those countries provide universal health care, i.e., for all of their people. The key question that we should be discussing as a Congress is, how does it happen that we spend so much money for health care but get so little in return? Frankly, I am tired of talking to doctors, and we'll have some here today, who tell me about the patients who have died because they were uninsured or underinsured and walked into their offices too late for untreatable conditions. And let us remember, again, not widely discussed, but we are losing, according to the best studies, over 60,000 Americans every year who die unnecessarily because they're uninsured or underinsured.
So let me know your thoughts here in the comments of Medicare for All. I'll show you this here on the screen. Senator Ed Markey and Senator Bernie Sanders are the main sponsors of this, have introduced Medicare for All with 14 other co-sponsors, colleagues in the Senate, saying more than 1 in 3 COVID deaths in the US are linked to lack of health insurance. Quote, in the richest country in the world, it is an injustice that millions of people lack basic health care. Too many Americans live on the cusp of financial collapse if they face unforeseen medical emergencies and devastating diagnosis and are forced to forego critical treatment altogether. And they want to introduce Medicare for All, and they are proud to co-sponsor this important legislation to make universal, affordable health coverage a right for every American. Quote, the American people understand, as I do, that health care is a human right, not a privilege, and that we must end the international embarrassment of the United States being the only major country on earth that does not guarantee health care to all of its citizens, said Bernie Sanders. Bernie Sanders says it is not acceptable to me nor the American people that over 70 million people today are either uninsured or underinsured. And a lot of Americans cannot afford their prescription drugs. And that's what they partially mean by underinsured. There are millions of people who would like to go to a doctor but cannot afford to do so. This is an outrage. Healthcare should be a right for all, not a luxury for some, said Senator Blumenthal. Quote, despite being the wealthiest country on the planet and spending more per capita on healthcare than any other comparable nation, America lags behind on critical health measures such as infant and maternal mortality rates, said Senator Booker. And the Roe versus Wade, if that gets overturned, that would actually probably hurt infant and maternal mortality rates even more. But I mean, we will see. As such, I am proud to join colleagues in reintroducing legislation that would implement Medicare for All, guaranteeing affordable health care to everybody as a right, not a privilege. Today in the United States, 68,000 Americans die each year because they cannot afford the health care they desperately need, and millions more suffer unnecessarily because of delayed treatment. About 44% of the adult population, some 112 million Americans, are struggling to pay for the medical care they need. Wow. And over 70 million Americans are uninsured or underinsured because of high deductible premiums. This program would be implemented over a 4-year period. The Medicare for All Act of 2022 establishes a federally administered national health insurance program that would ensure quality and comprehensive health care to all. This would include dental care, vision coverage, and hearing aids with no out of pocket expenses, insurance premiums, deductibles, or co payments, and save middle class families thousands of dollars a year. This legislation would also create a healthcare system that finally puts people over profits. Today, as millions of families face bankruptcy and financial ruin because of outrageously high costs of healthcare, the CEOs of 178 major healthcare companies collectively made $3.2 billion in total compensation in 2020, up 31% in 2019. While nearly 1 out of 4 Americans cannot afford the life saving medicine their doctors prescribed, last year Pfizer, Johnson & Johnson, and AbbVie, three giant pharmaceutical companies, increased their profits by over 90% to $54 billion. It's unbelievable. Sounds like the oil and gas companies gouging us, right? Again, you need prescriptions, you need medicine, just like you need gas, right? Meanwhile, the CEOs of just 8 prescription drug companies made $350 million in total compensation in just 2020. However, according to the Congressional Budget Office, Medicare for All would save $650 billion each year, improve the economy, and eliminate all out of pocket health care costs. I don't know exactly how this whole plan would work, but remember the Congressional Budget Office is not partisan. They're not Democrat. They're not Republican. They've been around forever. uh, and they basically study the math of these bills and proposals, whether they're Republican, Democrat, or anything. They're basically just the math. Math office, the Congressional Math Office, basically. So if they say it would save $650 billion a year, they're always, of course, things, can change. They're pretty good estimates. They're estimates, because you never know what's going to happen in the future and how the economy might change, right? But that's insane that it could be even anywhere close to that. Save $650 billion a year. And eliminate all out of pocket healthcare costs because it would be universal basic health care like Canada has and all these other countries has. All other studies, such as from experts at Yale University, is similar to Medicare right now, right? It's just like Medicare now. Estimate it could save upwards of $450 billion a year. Even a study done by the right wing Mercatus Center estimates that Medicare for All would save Americans more than $2 trillion over a decade. So that even still would be a significant amount of money. Let me know your thoughts here in the comments. And right now, the government actually says that they're going to have an extra $1.5 trillion because they're taking in more money because people are going back to work and paying more taxes, just like all these states are flush with cash and they have money from the last stimulus package here as well. Let me know your thoughts. Is this something they should use the money for? I mean, I guess it's going to save uh, us money. It's going to because I guess they won't be giving these billions of dollars to pharmaceutical companies. They'd be just using it on the people instead. So yeah, the harder part here would be to get it to pass and get Republicans to vote on it. Yeah, because this is a Democratic idea, and getting Republicans to vote on it, well, that might be the issue. I'll keep you up to date here on this. Let me know your thoughts. But really, when we think about Social Security, we think about Medicare, Medicaid, and these are really programs that have served vast millions and millions of people here in our country, and without these programs, where would our country be? Yeah, I mean, and really, but if you really look at a lot of these programs, I mean, we heard a little bit of it there. Um, Other countries have programs like this that serve everybody in their country, and do a better job of it. Now, the problem here is that it might have some hiccups going forward, and I can already see the criticism now. If the Democrats come forward with a program like this, all the Republicans will criticize it. If the Republicans came forward with a program like this, all the Democrats will criticize it. That's the problem here with our society, is that we're such a broken society that it's always one side battling the other. But what happens here is that we have people dying every year from lack of health care, lack of underinsured people, poor people, lower middle class people that are just don't have money to pay for this stuff. There's so many people right now that are just really missing out on a lot of these services. And if you have to pay for healthcare, it's just unbelievable. We have to pay for our own healthcare, our own monthly premiums and our deductible. Our premiums for our healthcare, me, my wife, and my son are as we have like a small business plan. It's over $1,000 a month per month, because we have basically like an all inclusive plan. Think about that. It's $1,000 a month. So I mean, when you think about it per person, it's about a little bit over $300 a month per person. Me, my wife, my son. So $300 per month per person. It's expensive. $300 a month per person, over $1,000 a month, and then our deductibles, $5,000 a year per person. So basically, they don't pay, but we have a $10,000 max. And think about this amount, right? So $10,000 per family. Okay, so basically, the insurance company doesn't pay anything until we pay $5,000 out of pocket per person per year, in addition to the $1,000 plus $1,000 and some change per month. That's how expensive insurance is. So when you think about like Medicare Part B, it's $170 a month. We're paying over $300 a month. So believe it or not, like Medicare Part B is cheap. If you have to go and buy your own insurance, um, it's actually more. It's actually more money, believe it or not. Yeah, it's not cheap, not cheap. And the problem here is that insurance continues to go up, 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 up. Yeah, things like insurance and the cost of college are two things that are just, and gas and food here recently. There's just several things that are just skyrocketing out of control, and we really can't control it. We really can't control it. And the cost of college is unbelievable. These colleges are just getting away with it, and I wouldn't be surprised if we don't see an overhaul of that here as well. Well, really, they're talking about some student loan debt forgiveness. The problem is people pay on their student loans for 30 years, and they haven't even paid off their student loan debt, and they're like, "Well, I've been paying my payment for 30 years. I still have the payment." It's just like there's a lot of things broken with our system. Even if you like do it the right way. I've seen some comments from some people saying I've been paying my payment for 20 years. I still have the payment. It's still there. Jimmy, they told me to go to college. They told me I needed a degree to get a good job, and I've been paying my payment for 20 years. It's still not paid off. It's just like I'm in my 50s. Not me. I'm relating some of the comments that I've seen. But people who say, Jeremy, I tried to do it the right way, and some of our viewers, some of our extended family here, are still paying on these loans 20 years later. Yeah, and that's where I'm of the feeling that any help that the government wants to provide, whether it's a student loan forgiveness, whether it's help with Medicare, Medicaid, any of these, meta anything, right? Anything that the government wants to provide, SNAP benefits, rent assistance, utility assistance, anything, stimulus checks, state stimulus checks, anything. In fact, I just did a really big video on stimulus checks. Anything going on here that the government can help with, by all means do it, because there's so many different things here that are just out of control expensive. uh there's a lot of people need help. So let me know your thoughts here in the comments. I'll keep you up to date here with everything. New videos come out here every day at 10 a.m., 3 p.m., and 8 p.m. Eastern Standard Time. Make sure to subscribe down below if you haven't yet. It's completely free to do so. After subscribing, click the bell icon next to it, and I will keep you up to date here. You can click here to watch my newest video next. And this is my really big, I just did a really big stimulus check update video. If you haven't seen that, click on that next. Really good video there. Thanks for watching, guys, and I'll see you in the next video.